Orthobiologics is a newer, more advanced form of orthopedics, and we're here at Carolina Nonsurgical Orthopedics with Dr. Matthew Kanaan. Today we're talking about a technique you're using called PRP. What exactly does that mean?
PRP is basically part of the blood, and so in this clinic we do biologic procedures, or what we call orthobiologics. The most common one is basically using your blood. We also take sometimes fat, or we take bone marrow. But today we're kind of talking about PRP, and that is the part of your blood that heals your skin or your muscle or your fat. We basically take your blood and we spin it, and then we kind of use that to inject into areas that are painful or areas that we want to stimulate healing.
What's the premise of using a technique like this?
So we've traditionally used steroid injections to treat tendinitis and arthritis, and more recently we're trying to find ways that are more natural. And so whenever you get a cut and you get a scab and the scab falls off, you have new skin. So you and I both regenerate, but our muscles, our tendons, our bones don't regenerate as well. So we've kind of found ways to take parts of the blood that help to heal the skin, and then we concentrate them and inject them into an arthritic shoulder, an arthritic hip, knees, tendons, tennis elbow. And what we find is that reduces pain and inflammation, sometimes better and longer than steroids.
And completely natural because it's coming from your body back into your body.
Correct. There's not a lot of side effects. People do very well with it, and people, I think they have a better time injecting their own blood versus injecting a chemical like steroid.
Sure. Take us through the process. We walk through those doors, something's in pain, our elbow hurts, our shoulder hurts. What's next?
I trained at Duke, and so we'll do a traditional orthopedic workup. So we have x-ray here, we have ultrasound. So I'll do some diagnostics, I'll do a physical exam. So it's everything like you would normally get in an orthopedic office. But then as we get to the diagnosis and we see what the ultrasound shows or the x-ray, then we'll really dive down into some ways to treat it. I do perform steroid shots here, I just like to limit them. And so then we'll have discussions around other alternative treatments like shockwave or PRP, stem cells from the fat or from the bone marrow, and like we said, the orthobiologic procedures. The primary one we use here is the PRP injections.
Is there a technique that you use here that's different than, say, other places?
You know, I've been doing this for 10 years, and medicine changes and science changes, and so what we're doing now is we're basically customizing PRP to you or to someone else. And what that looks like is a conversation about how much blood we're going to draw, how many billion platelets we want to inject, because what we're finding in the studies is that the number of platelets we inject is very important. Just like you're dosing a medicine, you're dosing PRP. And so if you come in for tennis elbow, I might need a certain amount of blood. If you come in for hip arthritis, I might need a different amount of blood. So we have different kits, we have different spin protocols on our centrifuges, and so everything is very custom. And then I can usually tell by looking at PRP if it's a good draw and it's a good injection, because I've been doing this for so long. There's places that advertise they do PRP, but there's very few people that specialize in it. And after 10 years, you really get the process down. And like I said, it's a very customized process. So, I don't like a one-size-fits-all when it comes to biologic procedures.
And let's talk about who actually is a good candidate for something like this.
So good candidates are basically anybody, right? So I inject as young as 14 years old. We've injected people that are over 100 years old. There really is no age limit. We don't inject people with blood disorders or blood cancers, but everyone else is a candidate because everyone has functioning blood.
So the best thing is probably to make that consultation, which we can do online, and you can answer any questions for us.
And it's very easy. There's lots of ways to get a hold of us. You can go to the website, carolinanonsurgicalortho.com. There's online scheduling. You can call in. We're very easy to get a hold of.